Multisystem inflammatory syndrome in children, or MIS-C, is a COVID complication that can lead to serious consequences if not treated early. On Wednesday, doctors at National Taiwan University Hospital listed early warning signs that parents should know. These include lethargy, a fever, skin rash, and swollen lymph nodes. Since the start of the Omicron wave, NTU Hospital has seen 15 young children with MIS-C. One of them was a 6-year-old boy who developed MIS-C 1 month after his COVID infection.
6-year-old Ray Ray poses with a stuffed toy. He was successfully treated for MIS-C at National Taiwan University Hospital. Even with a face mask obscuring his face, he appears to be the picture of health. But not long ago, he was in emergency care for recurrent fevers following a COVID infection.
Every time he had a fever, he had different symptoms. It might be rashes on some days, or he would have chills or a very inflamed throat, or the skin on his fingers would be peeling. His younger brother was different. He only had a fever, stomach ache, and vomiting. That made us think maybe it's only a stomach bug.
2 of the family's 4 children developed MIS-C. The older brother, Ray Ray, had the more severe case. At one point, he experienced shock and heart failure and was admitted to intensive care. His younger brother had milder symptoms, including diarrhea, but both developed swollen lymph nodes.
Watch out for other dangerous symptoms during a fever. For example, be on alert if there is lowered energy, fatigue, sleepiness, no urination for longer than half a day, apparent dryness of the oral mucosa, or if the child cries when agitated but there are no tears. All these are troubling signs.
The doctor urged parents to watch out for warning signs. So far, NTU Hospital has taken in 15 MIS-C patients aged up to 11. All of them were unvaccinated. Up to 60% had swollen lymph nodes in the neck and rashes, while others had conjunctivitis. More alarmingly, 40% experienced cardiogenic shock.
It's not always MIS-C when a child develops a fever several weeks after a COVID infection. There are other possibilities, the most common being roseola. Roseola occurs after a 3 or 4 day fever of 39 or 40 degrees subsides. In the case of MIS-C, rashes appear at the same time as the fever.
As of mid-June, more than 600,000 COVID cases were reported among those aged 20 and younger. Doctors predict that Taiwan will see nearly 200 cases of MIS-C in the future. Parents are advised to be on the alert for symptoms.